inviting me here to give this talk. So basically, this talk is going to be about tips and tricks for number one, how to avoid getting back pain, and number two, if you are suffering from back pain, then what are the quick fixes so that you don't keep on suffering from this back pain again and again. So I'm just going to share my presentation now, and we will start. So Dharma, can you see the presentation?
Yeah, sir. It is visible,
So thank you again. So I'm Dr. Sambhav Shah. I am a spine specialist. I've done my training from UK, Singapore, Germany, and I've been practicing in Bombay since 2016 now. And before that, I was a consultant in UK. And being in these various places, it taught me a lot because in every part of the world, the way they approach the spine is very different. The demographics of the patient is very different. The way the local people eat in Singapore is very different from the way the people behave in UK, from the way the people behave in India. For an example, in a city like Bombay, it's a very fast city. We are, all working. Everyone's in a hurry, but we also have the advantage of having a lot of local staff, so we don't land doing our daily chores by ourselves. And at the same time, when we were in UK, getting a staff at home is very, very difficult, and you're doing a majority work by yourself. So the amount of activity which you are doing is much higher. So everywhere, everywhere in the world, the way we find symptoms, the symptoms which patients come up to us are very different. And similarly in Mumbai, the kind of patient demographics I have seen in the last 8 years in Mumbai has been very different from all around the world. So my talk is going to be more focused about for people who are living in Mumbai, we all who are living in India, because our way of life, the way we are leading our daily activities, and the way we call our quality of life is very different. So let's start with the very common thing. Whenever patients come to me, the first thing before I even ask them what the problem is with you, they tell me that we have spondylitis. And that's because they've Googled their symptoms, which probably WebMD or some fake website online has told them that they have spondylitis. Now, what is spondylitis? So, if you Google what is lumbar spondylitis, it actually gives you the answer. It is an age related degeneration or wear and tear of the spine, which is the bone and the disc in the lower back or in your whole spine. So, age related wear and tear. So, is this a problem? Is this a condition which is actually can be labeled as a disease, or it is just a part of our aging process? So if you see here, this is a picture of me with one of my very, very close friends. He has white hair. I have a white beard. So should I label us as having hair whititis or hair or beard silveritis? No, it's not. It is just that we have aged like this. It is just our way of aging. Everyone is different. I have a white beard, but I still have black hair. He has white hair. Now he chooses to keep white hair, but if he wants to look younger, he can dye his hair black. So my whole aim today is that we are going to age. You are going to get white hair. But if you want to look younger, you can dye it black. So similarly, what is the dye available for us that we keep our spine, our back, our neck fit enough so that we always feel younger? So even at this age, I can do various things. People may say at this age, you should not be doing all these things. But actually, we can do it. So the groundwork of all happiness is health. This was said by someone, and I think this is where everything lands up to. You take care of your health today, your body will take care of you tomorrow. So to start with, in the spine, we have vertebrae. In between two vertebrae, we have a disc, and in the back, we have a spinal cord and nerves which come out of that. So usually our back pain is from wear and tear in the vertebra, in the discs, in the joints. But the pain when it goes down to your leg or to your arms, that pain is typically from some kind of a nerve compression. So you don't need to know anything more about the anatomy of spine except the fact that between our two vertebrae there is a disc and in the back we have a nerve. And another important thing to know, if you see the picture in the center, which is of the spine, this is our normal spinal alignment. And the way we maintain this alignment is the way our muscles are also going to manage and take this alignment into picture. So overall, all these factors is what helps you stay away from back pain, which I will now shortly tell you about. So I would urge all of you to look down. And if you look down and if you see a big tummy, you are going to get back pain at some point of time in your life. This is a fact that 80% of people get back pain at some point of time in their life. And lower back pain is one of the commonest reasons why people miss their work. And one of the commonest reasons for getting generalized back pain is your tummy. When you have a tummy, if you see here, the whole alignment of your spine changes. On the left side is a thin guy, and on the right side of my screen is a guy with a tummy. And when you have a tummy, your lower spine changes its direction, it changes its alignment to maintain the line of gravity. And in that, it makes your spine even more curved in the lower back and more hunched in the upper back. And this is the reason why your joints are under more stress and you will start getting back pain. So you have to make sure that you remain straight. Your stomach is inside. Obviously, if you have a six packs, it will be amazing. But even if not, if you can try and reduce that tummy, you will see a big advantage with regards to back pain. Maintaining good posture. All of us, from the time we were kids in school, our teachers used to always correct us for our postures. Be upright, be in a military upright position. And the reason is when you have a balanced upright posture, the alignment will always be neutral. Your gravity line will always maintain the same from the head to the foot. But if you are hunching or if you have a sway back or a flat back, your body will start changing its alignment to keep you upright. So your neck may start bending forward, or your knees will be under more stress if your back is not maintained. So your body compensates. Your body tries and changes alignment in various parts to in the end make you walk upright. So if you don't take care of your postures, if you are used to being in a hunched position, eventually with time it will further worsen your degeneration. So just a funny tip that great posture not only looks proper, but it also let's keeps the farts in. You will realize, and this is a fact, people who have a good posture, they have less acidity, they have less gas issues, and they have less flatulence. So posture not only helps you look proper, but it also helps you with your gut health. But again, looking proper, a lot of women are using heels. You see them using stilettos. And if you use them regularly, you're wearing high heels, especially women, if you're using high heels regularly at work as well as at parties, it is going to put a lot of stress on your lower back because it changes the alignment. I'm not against anything, wear it, but make sure that the amount of time you are wearing it for is less. In the end, you may look taller, but not at the cost of your spine. Now, when it comes to posture, also one of the biggest reasons why where people, their posture also goes off is when they are sitting. Majority of the people have desk jobs; they are on the computers, and especially in today's world, when you are on these webinars, your posture is absolutely good when you are on camera, but otherwise, when you're watching Netflix, you're watching videos, your posture is completely haywire. So, very very important how to maintain your posture also when you're working on a desk. So make sure that your chair. So a lot of people spend a lot of money on these high fancy chairs, ergonomic chairs. If you go on Amazon, you get chairs right from 20,000 rupees up to even 1.5-2 lakh rupees. But that doesn't mean that that 2 lakh rupee chair is not going to give you back pain if other things are not taken care of. So what you need is a chair which is 90-90-90. That means the back seat to the backrest to the seat is at 90 degrees, and your legs from the knee joints are at 90 degrees. So a 90-90-90 degree angle always keeps you upright and maintains your posture. Make sure you keep your shoulders relaxed. Your forearms should be parallel to the floor, and also make sure that your chairs have a forearm rest as well, where you can support your elbow and your forearm on the chair, and that takes away a lot of pressure from your neck muscles. Make sure that the top of your screen is at the eye level. The chair is also supported at the thighs, and your leg is bent at a 90-90 degree angle. If you maintain this, the chance of you getting back pain, neck pain will reduce significantly. Also, I'm going to speak about this again and again. Make sure that you keep on changing your position. If you are at the computer for 45 minutes to an hour, please get up for the 2 minutes. Go get a cup of coffee, go to the washroom, keep a bottle of water next to you. So you keep on drinking enough water. And every 1.5 hours, you can just go and use the loo. It becomes you have an excuse to get up, and it will be a reminder. So make sure you keep on changing your position. Again, a lot of times we get patients who are saying that they don't get back pain as such, but when they go to Lonavala, when they're driving, when they're stuck in traffic and they're in the car for more than 1 hour, their back becomes stiff, their back starts paining. So again, when you're driving, make sure that you don't use any fancy pillows in the back, because that also increases the curvature of your back. If you want to use a pillow, make sure that the pillow is spanning right from your buttocks up till your shoulders. Don't use those small pillows just kept near your buttock, because that can also increase the the curvature of your spine. Yes, if you do feel that you want some support, what you can do is just take a small towel and just keep it at the curvature of your back, so it just supports it. But again, the key thing while driving is that you need to get out of the car after every 45 minutes and just take that 10-second break. Also, it'll be worthwhile. Move your spine, move your legs, and it will help you ease off the pressure on the joints in your back. So adjust your seat, try a small support, and the most important is take regular stops. One of the other common reasons why people come with back pain. So there are a few these symptoms, or when patients come to us, a few things we have observed, which are very common, where a patient comes and tells us my back pain started because of lifting, number two because of taking a long drives, or number three in the early morning because of the way you are sleeping. So lifting is one of the commonest reason, and it is one of the commonest reasons why younger patients suffer from something called as slip disc. So it's not about lifting. Yes, if you have to lift something, you got to do it, but it's the technique of how you are lifting that particular object. So first of all, with regards to age, you think before you lift. Don't lift more than you need to. Sometimes you feel like kuch nahi hoga, and you just lift those 3-4 bags. That is that one moment which causes trouble. And keep the load close to your body. Don't bend far off and try to lift. A lot of people, especially at the baggage belt, when you're coming back from your flight and you want to go to the baggage belt to lift the bag, a lot of people, even I see at the airports, they're bending forwards, they're trying to get that bag in a hurry. Don't do it. You go close by, you tighten your stomach muscles, brace your back, and then you lift any object. So as you see in this picture, if you bend forward from your back and you lift, the amount of weight which you're lifting, the jerk is mainly on your back. But when you keep your back straight, bend your knees, and you go down and lift something, the core muscle, which is your abdominal muscle, takes the major load. And our core muscle is, as such, one of the strongest muscles which protects your spine. It is actually the spine's best friend. Core muscle is what, if you have a strong core, majority of you will never get back pain. Lifting also doesn't mean when you're going shopping. We see a lot of women at malls who are carrying, or in fact, a lot of the husbands are carrying majority of the bags, shopping for 2 hours each. Don't do that. Whenever you are stopping, take a break, sit on the bench, keep the shopping bags, or use a trolley. It's a very simple thing. Also, lifting your baby, go down from your knees and lift your baby. Even when you are ironing, adjust the height of your ironing table. Don't slouch forward and bend forward. Use those ironing tables which you're getting, where you can adjust the height. When people are sweeping, use vacuum cleaners, or you use brooms which are longer, where you don't have to bend a lot forward from your back. Those are very simple things which can prevent you from hurting or injuring your back. Again, a very common question, doctor, my back hurts when I wake up in the morning. I think a very simple solution is wake up in the afternoon then, but obviously it doesn't hold true for most of us. The reason why our back hurts in the morning, and for majority of us, is the way we are sleeping. The number one problem is the kind of mattress you are using. So a lot of people have older mattresses. These cotton mattresses, with time they have these small lumps inside, or the mattresses are really soft. When you sleep on it, you kind of sink in. So don't do that. Again, a lot of people say, I have a firm mattress, but you need to flip your mattress every 6 months, turn it around. Because if you're sleeping on the same position every single day, with time, that mattress is going to sink in. Your pillow should span from the head to the middle of your shoulder. We have a habit of just putting our head on the pillow. That's not correct. We all were not born with pillows. So if you lie down on a floor, you can see there are 2 points which touch the floor: the back of your head and the back of your shoulder. So when you're sleeping on a pillow, both these points should be on the pillow. And again, the pillow should be firm. It should not sinking. It should not be something which is very soft. A lot of people, when you go to hotels, they give this two, three very soft pillows. They are absolutely bad. If you want, the best thing is don't use a pillow if you are comfortable. But if you're not, use a firm pillow and make sure that it spans your head until your shoulder. Again, the style of sleeping. So if you're sleeping straight, if you're sleeping on the side, it's fine. Okay, but make sure the mattress is correct. If you see here in this image, the way you are people are sleeping with, they're sleeping on a very soft area. The whole curvature of the spine changes. The best sleeping positions are, if you want to sleep straight, you keep a small pillow under your knee, especially gentle people who are above 60, because at this point of time there is some arthritis in your joints of your spine also. Or I feel after 60, if you want, just sleep on the sides. It's absolutely fine. But never, ever sleep on your stomach. A lot of children, even 8, 10, 12 years old, including my children, they have a habit of sleeping on their stomachs. It is the worst thing you can do. When you sleep on your stomach, the pressure on your lower back is very high. You are turning your neck towards one side continuously, and there is an abnormal strain on your neck. So you are going to eventually wake up or have back pain in the future. A lot of patients say, but I sleep, but it doesn't cause me a problem. Yes, you are young, your muscles are still strong, but when you start aging after 40, 50, that's when all these issues will start worsening, and you will bear the brunt of what you have done in the past. So the best thing is prevention. Prevention is the best medicine. So just don't sleep on your stomach. A lot of us have a lot of neck pain. And when I see patients sitting outside in my clinic, also, everyone is on their mobile phones these days. And then they come inside and say, Doctor, why do I have so much of neck pain? And one of the biggest reasons why neck pain is because of mobile phones. Obviously, it has increased our incomes. The number of patients we see today is much higher, especially younger patients, much higher in quantity of younger patients in my OPD. Now, there was a time when, spine pain, back pain was a disease of people above 50, 60. But today, I would say it's almost 50%. And one of the commonest reasons why is mobile and laptops. So when you are bending your neck forward, the amount of abnormal pressure on your neck increases almost by 200 times. And that's the reason why you will have a lot of neck pain, because the muscles of your neck are under abnormal strain. They are bearing a load as if you have put 20 kg load on your head. If I put 20 kg load on your head, you are going to have pain eventually. And this is what just looking forward from a mobile phone does to you. If you have to see your mobile, if your work involves you using a mobile a lot, no worries. You do it, but sit in front of a desk, rest your elbows, make sure that your mobile phone is at the eye level. A lot of people, when they're talking, they tilt the neck towards one side. They're holding the phone between the neck and the shoulder. That is absolutely wrong. You are going to have neck pain eventually. Require use those Bluetooth devices, so at least your neck is straight. See this MRI. Normally your neck is at least straight or slightly tilted behind, but the picture on the right, as you see, the neck starts tilting. It starts bending forward even inside in the MRI. You may feel your neck is straight, but internally the neck starts bending, which puts abnormal load on the discs, and then these discs slowly start jutting out. And the day they start pressing your nerve, you are going to have significant symptoms. A lot of people who are in the diamond market, they're in assorting, looking at diamonds. Now, I understand that, this is your job, you got to do it. But there are ways and means to make sure that you still don't get neck pain. So eventually, I'm now going to just give you tips and tricks that even if the job demands a lot of pressure on your neck or your back, what are the things that you can do that at least you don't suffer? So the tips to the healthy spine. Number one, there are basic stretches. Okay, even if you can't do anything in life, just do this much. Do basic stretches. Stretch your back, stretch your legs, do hamstring stretches, stretch your neck. Spend 10 minutes at least every day in stretching. Even if at work you have an option of stretching, please do it. If you can't, go to the bathroom, stretch your back out, stretch your neck out, do basic neck stretches, tilting your neck towards the side, going back, doing chin tucks. And if you go to any physiotherapist or even if you Google, you will get these basic stretches available everywhere. There's a lot of material available on the internet. Just follow these basic things. Obviously, I'm using the word basic because this is just basic. It's not going to prevent you from worsening in the future. Those for that, I will tell you again what all is required. But at least this is something. If you have a job which demands a lot of strain on your neck, do this in between 3-4 times a day, and will just help your muscles to not go into a spasm. So as you see here, the muscle in red is called the trapezius muscle. It's one of the most, one of the strongest muscle of your body, but it's taking the weight of your head. When you're bending forward, your neck, it's taking strain. When your hands are in the air, like you are talking on the shoulder, or you're stirring, your vegetable or a dal in the kitchen, it is this muscle which takes all the load. So if you don't stress this muscle, you don't strengthen this muscle, you are going to have a lot of neck and upper back pain. So do these trapezius stretches. They are very simple. Keep your elbow behind your back and gently stretch your neck towards one side. It will stretch your muscles. If you can, take some mild weights and just gently shrug your shoulders up and down. Take a TheraBand. You can shrug your shoulders up and down, which will help you strengthen your trapezius muscle. And these are all very basic things. This is something which you can do any point of time, anywhere in the world, even if you are traveling, in your home, at your office, anywhere. Now, in general, for a more overall approach, if you want to maintain a healthy spine, I think swimming. Swimming is one of the best exercises I feel, which takes care of your overall body, right? From your shoulder, neck, hips, legs, everything gets strengthened. You may find, people injuring in various other sports. You will find a cricketer, a tennis player, all have some form of injuries. But someone who's purely swimming, you will never find that person injuring himself while swimming because we are weightless in water. So the more laps you take, it strengthens. You got to stretch out your whole body. You will never find a swimmer who has a stomach. We call something as a swimmer's body. They are always lean. They are fit. They don't have a tummy. So if you have access to a pool, this can be one of the best gifts you give to your body. Try and swim thrice a week at least, which will help you boost your health in every way possible. Another brilliant exercise from overall cardio point of view is cycling. uh, you know Cycling also, it gives you, it burns more calories. We have a lot of spinning programs available now, which helps you burn fat, which helps you reduce your stomach, which helps you reduce your weight. It does not put much pressure on your back. Again, don't start off on the first day cycling for 30 minutes. Take it easy, listen to your body. And again, a brilliant exercise which can be done indoors very easily. Walking. So this is one thing which I feel is too overrated. A lot of people come to me and I ask them, so are you exercising? It's like, yes, sir, regularly since 30 years. And I ask them, what are you doing? Oh, I walk every day for 30 minutes. Good, you are doing something. But in general, walking is not going to strengthen your system. It's not going to strengthen your core in that way. A lot of you might be going to Marine Drive or Jew Beach for a walk. You may be finding a lot of people who've been coming there for 15 years, but still those people have tummies. You will never find someone who's a athlete or a cricketer or any sports person that just by walking they are fit. Walking was in the past. We didn't have those facilities available. So as doctors, we would say, chalo walk karo, 30 minutes walk karo. But I think today facilities are available everywhere. A lot of buildings have gyms. Even if not, every lane now I think has a gym. Even if not, you can buy these equipments. You can buy basic therabands. You can buy, just do a plank at home, or cycle or swim. There are much more better exercises than just walking. You are out somewhere, you don't have any other facilities. Okay, you walk for some time, at least do something. I would say walking is fine. But otherwise, I think walking is a very overrated exercise, and I would really ask you guys to not count it as a form of exercise. Again, yoga, it's picked up significantly. A lot of people today, they come to me and they say they're doing yoga 3 times a week. Brilliant, you can do it. But I feel, again, just by doing yoga, uh, I don't think it is enough. Uh, Again, yoga has a lot of these extreme positions. They, like, for example, bhujangasanas, surya namaskars. And a lot of people, especially after the age of 55, 60, when they start yoga, and staying holding those positions for a time can cause increase in back pain. For an example, a bhujangasana or a surya namaskar, if you start doing it and you hold in that position for some time, it puts a lot of stress on the joints of your spine, and you can start developing back pain. So you start doing yoga, and if you're not doing it correctly, or you're doing some exercise or holding that position which you're not supposed to, based on how your spine is, it'll actually do more harm to you. So as number one, if you are in pain, first ask your doctor, because the exercises are also very different based on conditions to conditions. The exercises for slip discs is completely different. The exercise for spinal joint arthritis or back pain, just back pain, is completely different. So a lot of elder gentlemen or women above 60 of back pain actually are not supposed to do a lot of these bhujangasanas, because the major cause for back pain in the adult age group above 60 is the facet joints, the joints of your spine. And if you do this, it's going to increase your back pain. So pranayams, definitely, please go ahead. But if you have back pain and you want to start yoga, please consult a specialist before starting it. Now, this is one thing which I actually emphasize a lot on, which is strength training. And the reason why is that, especially after the age of 60, 65, there are two conditions. One is osteoporosis, and the other is sarcopenia. Osteoporosis is basically your bones becoming soft with age. Sarcopenia is you losing muscle. Your muscles become weak and you start losing muscle significantly. And the best way to avoid that is by doing strength training. Strength training doesn't mean you do this every single day. You please start with twice a week, thrice a week. Start gradually. Go to a gym. Start initially with a trainer, but it is very, very important. I myself have seen the 75-year-olds who are so fit. They are playing sports. They're coming to my gym as well. And when I ask them, "What were you doing? How come you guys are so fit?" And they would tell me that they've been doing strength training. So I've done a lot of research on this, and if this is done correctly, you can have significant advantages out of doing this. So on the left, this is a lady I'm showing you. She was a young girl. She had come to me with a lot of back pain. They were planning a baby. And if you see her, this is when she was 8.5 months pregnant, and she was still in the gym and doing exercises. So, there are a lot of myths. If you're doing it well, you go slowly, strength training can really, really help. But again, just remember that if you do have back pain, there are a lot of exercises which you have to avoid and few which you have to focus more on. So consulting a specialist is important in case you have. In case you never had back pain, then in general, you can set a routine for yourself with a trainer, and slowly, steadily, you can start doing these exercises. Then one more factor which causes back pain. You would think, how can food cause back pain? Obviously, food is very important, because having unhealthy food, again, having a stomach, eventually everything leads to back pain. So having a very balanced diet, especially the most important. A lot of patients even tell me that, doc, I am dieting, I am doing this keto diet, I'm doing intermittent fasting, etc., etc., and trying to lose weight. But again, the best I have seen is you need a balanced diet, you need that protein, you need that good carbs. But eating right food at the right time is very, very important. And again, if your health permits, then having a high protein diet is very important, because when you have a good high protein diet, it reduces the amount of fat storage. Your body stores fat, and the main area is your abdomen. And it stores more fat because the muscles don't get enough protein if you don't eat enough protein. So it's very important to have a high protein diet along with a balanced diet. Vitamins also very, very important. For example, vitamin D3 and vitamin B12, especially in vegetarians, B12 is always low because your food does not provide you with those vitamins. And D3 is something we get only from the sunlight, and most of us are not going out in the sun. Even if it do, it's absorbed through your skin. They're covered by clothes. A lot of Muslim women who wear burqa, their D3s are very, very bad because they're covered completely. So you need to take these supplements regularly. Uh, After a particular age, especially, make a regime. Your calcium, vitamin D3, vitamin B12, vitamin E, vitamin C. These are all important medications. I also don't believe that you have to take all of this every single day. Obviously, based on there is a way where we can figure out what's your perfect course for you by doing a test before you start the medications and then repeating those blood tests after 3 to 4 months, which gives us a rough idea. By doing a bone density test. So there are a lot of ways where, as clinicians, we know and we can formulate a proper course for you. But by taking these vitamins regularly, it does help in maintaining a strong spine. And one of the most important thing I feel you want to avoid back pain and neck pain is stress. If you saw the earlier image, our spinal cord is our brain ends and becomes a spinal cord. It's the electrical wiring between your brain and your muscles. A brain is a very smart organ. The minute the load increases in that brain, it is going to first send that load to the weakest areas of your body. You walk into any investment banking or any high stress jobs, and you see majority of the people are just holding their necks and turning their necks and saying that they are in pain. And one of the major reason why is that they have stress. I'll give you a very simple statistic, and including in my clinic and even clinically research statistic, that 1 out of 4 patients, when they come into a clinic and they have back pain or neck pain, one of the majority reason is stress. And we can clearly make out if you ask them simply, when you're on a holiday, is their pain, even though they are walking so much, they are traveling, but the still pain is less because they are less stressful. So stress is a very important factor. We can do whatever scans, you will do MRIs, PET CTs, and everything turn out to be normal. But it's a very simple thing, which is stress. So maintain a work-life balance, meditate, you know, find a way where your stress reduces, listen to music, create a habit, create good habits, get a hobby. And I think overall, if you can manage to reduce your stress, I think 50% of your back and neck pain is just going to disappear over there. So keep moving. Do not stay in a wrong position for a long time. But the most important thing is don't stop doing things. A lot of people come and tell me, Doc, I'm going to stop playing tennis. I'm going to stop dancing. I'm going to stop doing this. I think if you love doing something in life, you should not stop doing it, because that is what is driving you forward. That is what is keeping you happy. So if you should be even a 40-year-old, if you want to dance, you should be dancing at 75 also. But if you want to maintain that, then you have to find that balance in your life. You have to make sure that you are fit. Don't stop doing things. Just change the way you go about doing them. And that is the most important thing. So just to give you just a recap. For me, I think strength training, endurance, cardio, yoga. Twice a week, you can do strength training. 2 times a week, if you want, you can do yoga. Do other days, you can cycle, swim. So create a mix of things so you don't get bored. If you enjoy doing something more, you can do it even 3 to 4 times a week. But again, if you just keep on doing cardio, it's not going to help. If you just keep on doing strength training, it's not going to help. Focus a lot on your core strengthening. Swimming, cycling are brilliant. They're better than walking. High protein diet, drink enough water, take breaks, change positions, maintain your vitamin levels. And the most important, being disciplined at doing it consistently, and find motivation in doing it. It could be a friend, it could be a partner, it could be a boss, it could be someone you look up to. Find these people motivate yourself and make sure that you do it and start tomorrow. Now, in spite of doing everything, even if you still have pain, you're ignoring it, the pain is going on for more than 2 weeks, then I think that is a red flag. Any pain which goes on for more than 2 weeks, it should be checked out. In fact, any symptom, it could be a cough, it could be a headache, it could be knee pain. If it goes on for more than 2 weeks, it's your body talking to you. So please listen to your body and consult a specialist. Another question I get is, when you have pain, what should you do? You should apply ice or should you apply heat? So ice packs for acute pain. If it's you've lifted something and you've started having pain, apply ice for 24 to 48 hours. It will reduce the inflammation, it will reduce the pain. But for chronic pain, for pain which you've been suffering for some time, or you get it on and off, heat works much better because it relaxes your muscles even more, and it increases a little bit of blood circulation. So you can use heat in chronic cases, but for acute cases, acute injuries, use ice packs. Now, if you have pain going down the limbs, if you feel weakness in your limbs, if there are issues with passing urine, difficulty in passing urine, or you don't have control over your urine, or if you have no improvement in your symptoms or worsening, then these are red flags. This is something which you should not ignore, and you should definitely visit a specialist or a doctor as early as you can. Now, another question which I get regularly, that I've been told bed rest, or doctor, I did bed rest for 8 days when you have pain. This is a very big myth. Bed rest does not reduce your pain. In fact, there was a very big study which was done, and the group of patients who had pain but who stayed active, they showed that there was a higher reduction of back pain and faster recovery and faster going back to work when they were doing basic things. So just lying in bed will not improve you. Yes, if you're in acute pain, it may restrict you from doing strenuous activities, but keep on moving. Even when you have pain, the more you move, the more you change your position, the faster that muscle spasm will go. Again, a lot of people say, I had slip disc and I was told to do bed rest. It does not work. Okay, majority of slip discs, they get better with time. 95% of them, within 3 to 6 weeks, they will get better. I give you medicines, you may feel my medicines have made you better. Someone has given an injection, you may feel that has made you better. You are doing yoga, you may feel Ramdev Baba has made you better, but it's not. Generally, majority of them just get better with time. So slip disc is a very common cause for leg and back pain. The pain in the leg is because when the disc slips out, it compresses the nerve, which increases inflammation in the nerve, which causes significant pain. Slip disc is more common in younger patients, and stenosis is something which is actually more common in old age. It is basically narrowing of the spinal canal from which the nerve goes. And this narrowing is because of degeneration, it's because of wear and tear in the back. And obviously, if you don't take care of yourself as you are young, it can cause more issues. And as I said, 90% are just treated with exercises. Injections may help in the pain control in the start, but for patients in whom pain does not get better, or they have paralysis, or they have major issues, then a simple endoscopic spine surgery is one of the best things, which I'll just take last 5 minutes now. So as you see here at the lower level, there is a big disc at the L5S1 level in this patient, which is pressing his nerve. Similarly, this is an MRI. If you see on the left, it's a normal MRI. You can see the spinal cord very well. But on the right side, you see the nerve is getting pinched by the slip disc. And this can give the slip disc in the neck can give you a lot of arm pain and upper back pain, and a slip disc in the lower spine will give you a lot of lower limb pain. So main thing is that we conserve it with exercises. If not, then we can give an injection, but the injection does not take the disc away. It just calms your nerve to buy time for the body to heal that disc, to take away that piece of disc which has compressed your nerve, and eventually you get better. And if not, then surgery is a very quick way out. So when to say yes for surgery, a lot of patients say, कि अभी ये उम्र में 65 की उम्र में how can I do a surgery? I think age is just a number. Growing old is compulsory, but behaving old is optional. These are all these people in front of you, and we have Amitabh Bachchan as well, whom we all know. It doesn't matter how old your age is, you can still decide, how you want to behave and stay. So a lot of patients who are otherwise very, very active, So if you see her, this was a 101-year-old lady with a spinal fracture. Now, obviously, if this patient was in significant pain, and if she's going to remain in the pain, she's not able to move. This was someone who used to go to the bathroom at least by herself, but she was stuck in bed for a month. And a simple surgery under local anesthesia took her off her pain, and she was home in 2 hours. And at least she was not suffering from that pain anymore. So if it's affecting your activities, it's affecting your quality of life, you failed of conservative measures, or if it's compressed your nerve so badly that you are getting paralyzed or your bowel bladder is involved, you have to go for surgery because it can really improve your quality of life. Okay. So the minute I tell a patient surgery, it's like, I'm a ghost. Everyone gets scared. Everyone jumps out of the chair. Arey doctor to rawa ne kya bolta hai, khali kaat raha hai, but that's not true. There are some instances where you need to do it, and there are myths, especially with spine surgery. Majority of patients come and say, "अरे मेरे चाचा के भतीजे को ये किया and then he was paralyzed," और इनको ये हुआ और वापस surgery करना पड़ा, or my after surgery also I'm not get better. My friend got worse after surgery. So these things were there in the past when open surgeries, technology had not evolved. We used to carry big dabba phones. From there, we've come to small size phones. We've come to smartphones. So with technology, everything improves. There were a time when there were big incisions. People after surgery were told to lie in bed for 2 weeks. A lot of pain because there was a lot of muscle damage, a lot of blood loss, and there were a lot of complications. But now, because of minimally invasive spine surgery, all these things are negated. There are 4 millimeter incisions. I do my surgeries under local anesthesia. Patients are made to walk immediately after 1 2 hours. They are discharged the same day, and there is very minimal pain. So if you have a slip disc and you're suffering for 1.5 months, pain is not getting worse. It's affecting you. Not going to office. With this surgery, within 2 hours we'll be walking, and within 3 4 days you will be back to your office. So it has really changed the way we are treating all these discs now. So it's a simple thing. We insert a camera in the spine. We have a big monitor in front of us, and the whole surgery is done by watching on a TV. It's the incision size is hardly anything. You don't see it at all, and you're standing immediately after surgery. So if you see in this picture, the faint line is someone who had got operated in the past 15 years ago for for a disc at L3-4 level, but then this patient had the same different disc at L4-5 level. And if you see, even for this surgery, even though it was operated in the past, the incision size is so small as compared to what used to happen in the past. So if I compare another surgeries, microdiscectomy, even where they use a microscope to use it, it's still almost a 5 centimeter incision. A lot of people put tubes and do the surgery, which is still a 2 centimeter incision. But now with endoscopy, we are doing them within 4 to 5 millimeters. Cosmetically, I don't think minimally invasive surgery, as the scars are less, but it is the advantage anatomically to the patient, to the spine. But it's not just about the internal of the spine, even external is important. A lot of young girls, a lot of people now want to wear such backlash cholis, but it's not just girls now, but even boys want to show off their bodies. So the scar does matter. And the smaller the scar you have, obviously, it does not impact, the cosmetically the way you are looking. So this was
Hello there, my name's TJ Zuvik, and I am here playing pickleball, which is something that I would not be able to do if it wasn't for Dr. Sambhav Shah. So 30 days ago, I had an endoscopic spine surgery at L5S1 for a herniated disc. Okay, I was in a really bad spot before that. I wasn't able to walk. I had a really bad muscle cramp that basically had me all twisted up. I wasn't able to sit. I just had to basically lie on my back, and this was the case for months. I wasn't able to play sports or even enjoy a meal with my family. I live in Bali here, and I had my family over actually for a month, and I couldn't go out one single time with them. I couldn't even really have dinner with them in the house. So it was really, really, not only was it physically painful, but it was emotionally pretty wearing on me. So, but a month ago, I had like I said, an endoscopic surgery in India, and here I am 30 days later at the court.
So as you see, this guy, young chap, 31 years old, athletic guy, was playing pickleball, playing tennis regularly, and he was so badly stuck. Obviously, even he was scared of surgery, and he stopped playing for almost 8 months. But because he was not getting better, then I finally told him, just get the endoscopic surgery done. And in 1 month, he is back to his court. So 6 months of not doing anything, he became fat, he had a tummy, he lost all his muscle strength. You're doing more harm in not doing all these things. So now with technology, we have all these things available. On the right, you're seeing the guy. He was a local farmer. He had come to me from Nanded, you know, and he had a slip disc in his neck. Now, this he's a farmer. He has to lift weight. He has to, every day, whatever he earns, uh, his family eats food. Now, if I tell him, if I do major surgeries on him, he will be stuck for 2 to 3 months. Just by putting a camera from the back of his neck, I removed his disc, and he was better in 3 hours, and he was discharged the next day, and he will be back, lifting his grains and other things within 1 month's time. So this has significantly changed the quality of life. We have various computer-assisted surgeries also, which has improved the way we are doing the spine surgeries. So I think now there is not a major fear about these surgeries. A lot of common men have the fear spine surgeries, but one common thing between all these people you see on this picture is that all of them have underwent spine surgeries, but they're still leading a normal life. So don't listen to those one-off cases. Yes, things were bad in the past. There were a lot of complications, but all these things have significantly improved because of the way technology has evolved. So thank you very much. So if you see this slide, we started off as monkeys. We were Homo erectus. We were standing straight upright. But obviously, because of the way the technology has evolved, I just hope that we don't go to where we are and become these slouched people that you can see on the right side of his image. So thank you very much. And now I think we'll be open to questions.
Yeah. Thank you so much, sir. It was a wonderful presentation, sir. We got a lot of insights, and I'm sure all the people are eager to ask the questions around, sir. So I have first person called as Anju Bansali, madam. Can you ask your question? You can unmute yourself and ask your question to Dr. Sambhav.
Hello.
Yes, ma'am.
Sir, I'm Anju Bansali.
Yeah.
અને આપસે મેં તમને પૂછ્યું હતું કે મારે સ્પાઇનલ કોડ ને
Yes.
એમાં 12 પર ફ્રેક્ચર થયું છે.
Right.
તો વર્ટિબ્રા શું કહેવાય છે મને ખબર નથી.
જો
તો એમને મને બેલ્ટ પહેરવાનો આપ્યો છે આખો. એને 1 મહિનો રેસ્ટ લેવાનું કીધું છે કમ્પ્લીટ.
So see exactly मुझे बोलते हो कि now if your symptoms કે તમારા symptom અગર pain જ હોય પણ તમે અગર ઊભા થઈને ચાલી શકો છો ફ્રેક્ચરમાં typically what happens is the pain is worst in the morning કે તમારી પોઝિશન બદલવી હશે ત્યારે સ્ટાર્ટિંગમાં તમને દુખશે પણ પછી દુખાવો ઓછો પણ થઈ શકશે. But 1 month of bed 15 દિવસ of bed rest તમારા muscles પીગળી જશે. Your overall strength in your body reduces significantly. So one thing is at permissible, you should keep on moving. You cannot lift any weights. તમે કઈ વજન ના ઉપાડી શકો હમણાં. But majority of these fractures એની ટાઈમથી પણ સારા થઈ જાય છે. But અગર પેન વધતું જ રહે છે કે તમારી ક્વોલિટી ઓફ લાઈફ ખરાબ કરે તમારે થતું જ ના હોય, then we have to investigate further. એક સ્કેનિંગ એક્સરે કરવો પડે, બીજું એક MRI કરવું પડે, જોવા કે આ ફ્રેક્ચર હીલ થાય.
MRI કરાવ્યું સર, એમાં પકડાયું, એક્સરે માં નહીં પકડાયું.
તમારામાં અગર અંદર પાણી દેખાડતું હોય કે અંદર સફેદ છે અને પેન બહુ જ ખરાબ હોય તો આ સિચ્યુએશનમાં આપણે બે નાના કાણાથી ખાલી એમાં સિમેન્ટ ભરી દઈએ અને જેનાથી after half an hour you can go back home and 90% of your pain will go and you can start normal activities from the next day.
તો સર મને ઈચ્છા હતી તમને મારો રિપોર્ટ બતાવું.
Sure, you can just message કરી કાઢો. We will give you all the details and then we can talk further.
Sir, what we can do is we can share your clinic details, sir. We'll share your clinic details, sir, in the group.
Sure.
Yeah, sir, we will share your details in the group so that they can connect.
Right. Any other questions?
Yeah, doctor. Next is Sejal. Sejal, madam, you can unmute yourself and ask the question, madam.
मैं की बात करूँ છું. અને મને 2 વર્ષ પહેલા બેક પેન હતું, એમાં મને 5 મણકા દબાય છે એમ કીધું હતું. પણ હું બેડ રેસ્ટમાં 6 મહિના જેવો બી કર્યો, મારી ફિઝિયોથેરાપી બી કરાવી અને મારું બોડી બહુ છે, પેટનો ભાગ બહુ છે, જે તમે મને કીધું મેં સાંભળ્યું. પણ ચાલુ ને તો મને બેક પેન બહુ થાય ને મારે 2 નીના પણ પ્રોબ્લેમ છે. તો મારે આમાં શું કરવું જોઈએ સર?
Normally now, see back pain, as I said, back pain usually we never even say surgery for back pain, because majority of the reason for back pain છે your muscle strength, તમારી core strength, તમે whatever activities you're doing. Now based on તમારા findings and what you are just telling me, obviously મારે I have to see your MRI, X-rays and examine you, but based on just your symptoms, it is mostly અગર તમે આમાં પેટ પર જઈને ભુજંગાસન કરશો કે તમે સૂર્ય નમસ્કારો કરશો, this may increase your pain. So you have to concentrate more કે તમારે તમારું core strength વધારવાનું છે. એક. Number 2, you should check yourself for osteoporosis. કારણ કે osteoporosis ના કારણે પણ back pain is significant. જેના માટે we do sometimes something called the DEXA scan. But majority of the times, if you have followed correct diet, right type of exercises, maintaining bone health, હું એમ નથી કહેતો કે તમારું બેક પેન જિંદગી પર જતું રહેશે, બટ ઇટ વિલ લેવલ કે તમારે 6 મહિના બેડમાં રહેવાની જરૂરત નહીં પડે. અને બેડમાં રહીને ઇનફેક્ટ તમે તમારા મસલ્સને વધારે વીક કરી કાઢો છો.
હા, એટલે મારે 6 મહિના એ વખતે રહી હતી. હવે તો થોડો વખત રેસ્ટ કરું ને તો મને સારું લાગે. પાછું મને એમ થાય કે થોડુંક કામ કરું ને, અને હું છે ને વર્કિંગ વુમન છું ઘરેથી, એટલે હું બધું નાસ્તો બધું બનાવી, એટલે મારે ઉપર બેસીને હું બધું કામ કરું છું, પણ મને નીમાં પણ એટલો જ દુખાવો થયા કરે છે.
Because you are not putting load on your body. You are not loading your body. So તમે લોડ નહીં કરો, you will never, your pain will reduce. But the point is કે તમે કેટલી વાર માટે કરશો એ. સો તમે લોડ તમે વધારે ઓછું ના કરી શકો તો તમારે તમારા બોડી માટે સપ્લાય વધારવી પડે. ઓલવેઝ ડિમાન્ડ સપ્લાય વાત છે આ. હવે તમારે બોડી વધારશો તો તમે સપ્લાય પણ વધારો. સો યુ હેવ ટુ exercises, you have to do the right thing. So obviously મારે થોડું ડિટેલમાં જવું પડશે, તમારું MRIs ને બધું જોવું પડશે.
તમે ક્યાં છો બોમ્બેના સર?
કેમ્સ કોર્નર ડિટેલ્સ મૂકી દઈશું ચાર્ટમાં, તમે તારા નંબર એડ્રેસ બધું મળી જશે.
હા, તો હું તમને આવીને એકવાર મળીશ.
Sure.
And thank you so much for your
No problem, my pleasure.
મને તેને બોલાવાનું છે. હેલો.
Yeah, બોલો.
Hello, myself Mrs. Vidya.
Yeah, hi.
Good evening, sir.
Yes, please. Hi, please go ahead.
Sir, just now I got my MRI done. In MRI, they have shown antherolisthesis. L4 or L5. Yeah, grade 2.
Yes.
And doctor 2-3, I have shown to 2-3 doctors. I took opinion and all are suggesting me to get operated surgery.
Right. So see, anterolisthesis is basically when your one vertebra, it shifts forward. So what happens is you have two bones and the disc in between. Your vertebra moves forward like this onto the lower vertebra. Okay.
Same.
Give you back pain and that can give you leg pain also. Right. Now, if your back pain and leg pain because this is not a condition which has happened recently. This is a slow process which has been there with you, but over time it starts getting worse and worse.
Yes.
So the number one again in those instances is exercises, maintaining your health. But obviously, if with time also or doing everything, your pain is not worsening, or sometimes what happens is that a lot of patients say, I want to exercise, I want to do everything, but the pain is so bad that I can't. Right?
Yes.
Then in that instance, yes, surgery can give you significant benefit, especially if you're doing a minimally invasive surgery where we put screws minimally invasively, you free your nerves with small holes. We operate on a Monday morning, by Monday evening, by Tuesday you're walking, and by Wednesday you are discharged. This also can be done under spinal anesthesia. So it is not honestly any spine surgery is major, but as I said, with technology and with time, everything has changed. And if it is affecting your quality of life, if it is affecting your activities of daily living, and it has been a while, and you've tried everything, then yes, you have to make sure that you get it done. Number 2, in the exercise, make sure that you are not doing extension-based exercise. So what I was telling I talk. Suppose you do yoga and you start doing bhujangasanas and surya namaskars, your pain will increase.
Oh my God. Okay.
Temporarily, you may feel better, but in the long run, it will increase your pain.
Okay.
So don't do those exercises. You have to do more of flexion-based exercises. So bending forward. Now again, a lot of people tell you don't bend forward. Jhuko hi mat. That is wrong. For you, in fact, bending forward as a form of exercise is a better exercise than going behind.
Okay. So I can bend. I should take rest for at least 1 month.
I don't believe in bed rest. I feel if your pain is not good, because you will take rest for 1 month, but what is the anterolisthesis in your spine is not going to go away. It is going to remain. But your muscles will ache. Then after 1 month, the day you start waking up, I start moving around, within 10 days, your pain is going to be back. Again, this is your condition.
Okay.
In spite of doing exercises, in spite of taking care of your health, if you have lost weight, when things are not just working out for you, then surgery will give you significant relief. Then you have to go.
Sir, precautions, what I should take precaution then?
Just
and for how many days?
Don't lift anything heavy. Don't sleep on your stomach, and don't do the wrong exercises. This is the only thing which you have to avoid. But what you have to avoid, it is what you have to do. So your regular exercises, good diet, high protein, your the amount of water you take, all these things are important.
Okay, sir. Thank you, sir. Sir, your Dispa clinic, where it is, sir?
It's at Keb's Corner in South Mumbai.
Okay, sir. If I want, I can come to you, no?
Sure. We have given the details in the chat.
Sir, we have given it in the WhatsApp group.
Thank
Sir,
you,
we
sir.
have already shared in WhatsApp group, and sir has shared his contact details in the chat option. Everyone can check the details, contact details, and the address details. Usha Dubey, you're next. Can you unmute and ask your question?
Good evening, doctor.
Good evening.
सर मुझे एक्चुअली बहुत लॉकडाउन में जब काम करना पड़ा था मुझे, उसके बाद मेरा बैक पेन बहुत ज्यादा तकलीफ दे दिया मुझे, और वो उसके 1 साल के बाद आफ्टर टेकिंग दिस कोविड वैक्सीन, ये कोविड का वैक्सीन लेने के बाद वो बैक पेन पूरा राइट साइड से पीछे से लेके फ्रंट में पेट के पास आता है सर, और बहुत मतलब बहुत ट्रीटमेंट किया लेकिन कुछ फर्क नहीं पड़ रहा है।
क्या किया ट्रीटमेंट में?
ट्रीटमेंट में भी लास्ट मई में 8 में मैं एडमिट भी थी हॉस्पिटल में।
क्या किया? फॉर एन एग्जांपल, मैंने जो आपको पूरे मेरे स्लाइड्स में दिखाया, एक्सरसाइज, वेट लॉस, साइकिलिंग, उसमें से कुछ भी आपने किया है?
नहीं, एक्सरसाइज करने के बाद बढ़ जाता है। मैंने क्यू स्पाइन भी 6 मंथ्स का किया था, लेकिन मेरा पेन बैलेंस नहीं रहा, तो उन्होंने बाद में बोला कि आप रीढ़ की हड्डी में इंजेक्शन ले लो करके।
पैर में बैलेंस नहीं होना, दैट कैन आल्सो बी अ साइन ऑफ स्पाइनल कॉर्ड कंप्रेशन. ओके, और अगर बैलेंस जैसी चीज थोड़ी ऑफ होती है तो यस, उसके लिए हम थोड़ा अग्रेसिव रहते हैं. लेकिन अगर खाली बैक पेन, अभी अगेन अगर आपका बैक एमआरआई में इफ इट इज शोइंग कि ज्यादातर आपके जॉइंट्स का इश्यू है, सबके एमआरआई में थोड़ा बहुत डिस्क की खराबी ये सब तो दिखा नहीं वाला, बट इम्पोर्टेंट थिंग इज कि क्लिनिकल और रेडियोलॉजिकल फाइंडिंग्स मैच हो रहे कि नहीं. I have to treat the man, not the scan. स्कैन भले 50 चीज दिखाए, लेकिन आपके सिम्टम्स कैसे है, किसमें एग्रेवेट हो रहे, क्या करके एग्रेवेट हो रहे, ऑल दीज थिंग्स आर वेरी इंपॉर्टेंट, और उसका कोरिलेशन होना चाहिए. अगेन, आप जो तरीके से बता रहे ना, आप कोई भी एक्सरसाइज कर रहे थे जिसमें कमर पीछे जाती है या सीधा लेट के कमर उठाते हैं?
नहीं रहा है, छूट गया है सर, मेरा बिल्कुल ही नहीं हो रहा है, और अभी सर्वाइकल पेन भी आ गया है मुझे.
So ये भी कॉमन है. Once back pain is there, the pain travels to the neck. Again is some muscle. So honestly ये है, मेरे को आपका एक बार MRI पढ़ना पड़ेगा, because जो मेरे टॉक में भी बताया कि एक्सरसाइज करना खाली इंपॉर्टेंट नहीं है, लेकिन अगर आपका बैक पेन है, द राइट टाइप ऑफ एक्सरसाइज इज वेरी इंपॉर्टेंट.
तो सर कैसे पता चलेगा, क्योंकि डिफरेंट लोग डिफरेंट बताते हैं. अभी मैंने बहुत सारे डॉक्टर्स को दिखाया है.
अनफॉर्चुनेटली इसीलिए बहुत लोग बैक पेन से सफर करते रहते हैं, बिकॉज अब बैक पेन पे आपको विशेष टिप्पणी देने वाले बहुत मिलेंगे. ओके, बिकॉज इट इज सो कॉमन कंडीशन. और कुछ लोग जैसे मैंने बताया कि आज स्लिप डिस्क होता है वो अपने आप ठीक हो जाता है, लेकिन कुछ लोग बोलेंगे ये दवा लो उससे बेटर हो जाता है, आप ये करो इससे बेटर हो जाओगे, ये करो इस बेड रेस्ट करो, लकड़े पे सो जाओ, जमीन पे सो जाओ, देयर आर लॉट्स ऑफ थिंग्स, बट इम्पोर्टेंट थिंग इज जो मैंने देखा है इस क्लिनिकल एग्जामिनेशन और क्लिनिको रेडियोलॉजिकल कोरिलेशन, आपके सिम्टम्स और आपका एमआरआई मैच हो रहा है कि नहीं, उसके ऊपर से इजीली डायग्नोसिस मिल जाता है। नंबर 2, एज, ऑस्टियोपोरोसिस है कि नहीं, आपका D3 B12 क्या है, आप कैसे एक्सरसाइजेस कर रहे हो, आपका वजन, देयर आर लॉट ऑफ फैक्टर्स। सो बट आई डोंट थिंक ऐसे कोई पेशेंट्स मुझे एटलीस्ट होपफुली विद माय ट्रीटमेंट के विद टाइम एंड टाइम इट इज गोइंग ऑन इंक्रीजिंग, सो आइदर समवेयर कहाँ कुछ गलत हो रहा है या कुछ गलत एक्सरसाइज हो रही है, सो आई विल नो मच बेटर वंस आई सी योर एमआरआई। बट मोस्ट इंपॉर्टेंटली अगर आपके बाजू में भी डॉक्टर हो, अगर आपको अभी के लिए एटलीस्ट आई कैन गिव यू टिप कि जो एक्सरसाइज आपको बेटर कराता है आप वो कंटिन्यू रखिए, जो एक्सरसाइज से आपको लगता है कि मेरा पेन बढ़ रहा है वो आप अवॉइड कीजिए अभी के लिए, एंड सी इफ दैट आल्सो हेल्प्स यू।
अच्छा सर, अभी मैंने एक्सरे भी निकाला सर्वाइकल का 6, अभी डॉक्टर मतलब जुपिटर हॉस्पिटल में बोले थे उन्होंने निकालने के लिए। अभी मैं लास्ट
ये एक्सरे और वो सब तो मुझे अभी एक बार मैं देखूंगा तो ही मालूम पड़ेगा,
तो
बट
अभी दूसरे डॉक्टर को दिखा है तो उन्होंने अभी एमआरआई अगेन बोला, क्योंकि लास्ट ईयर का मेरा एमआरआई है, उसके पहले का सीटी स्कैन है, एमआरआई है, फिर अगेन उन्होंने मुझे कल निकालने को बोला है, तो इसके लिए
मैडम we can keep the questions a bit short because बहुत सारे लोग हैं in the queue waiting for their answers.
One minute.
Maybe you can connect with the surgeon directly later on.
ओके सर, फिर उन्होंने फिर आज किडनी का वो क्रिएटिनिन लेवल टेस्ट हुआ है, तो कल मुझे जाना है मॉर्निंग में, तो वो
करवा लीजिए if it's been 1 year, and if then just show it to us once or forward the MRIs and everything to our clinic, and then in whatever best way we can we'll help you out.
Okay doctor. Okay, thank you.
Next please keep your questions short as we are running short on time. Vignesh Pillai, ma'am, you can go ahead and ask your question. You can unmute and ask your question.
Yeah, I'm Rakhi Pillai. Actually, Vignesh is like my son.
No problem.
Actually, sir, good evening, sir. I have been facing, the lower back pain again and again. Again and again, I'm getting jerk in my back. So before 1 month also I got, and after 1 month now also I have got. Initially in 2014 or 11, I took an MRI and it was showing like there is a multiple gap between the lower spine, like L1 to L5. And now I took out an X-rays, it was nothing was showing. So what do you suggest in that?
Well, see the multiple gap. Now I'm glad you have used this because even someone in the 2-3 patients use the word multiple gap. Multiple gap is actually a very wrong thing to, because it's not gap, it's a disc, which is normal to have.
Okay.
Or two, sometimes the MRI, the disc is slightly normal to have at a particular age. So everyone above 55 will have some bulge or the other in their spine. It is, as I told in the start of my spine, that it is basically white hair. It is how your hair becomes white, your spine degenerates. So it is not about the gap. Maybe you've not been diagnosed correctly, but again, if it's back pain which is causing you a majority of the issues, it is usually the spinal joints, it is usually the muscles, it is usually osteoporosis, it is usually the amount of weight you have. All these things are a bigger factor. And as I said, if you follow all the things which I mentioned in the lecture, there is no way your back pain will not get better. 75% chances that you will be at least 70 to 80% better. Yes, back pain again is not something which is going to go away forever, but it will not be so bad that you will have to even do anything about it. Sorry, you have to unmute yourself, ma'am. Unmute yourself.
What do you suggest? I should go for an MRI again and show it to you?
If it is been chronic for many years, then yes, MRI will always help.
Okay, fine. So I'll contact you.
Sure.
Okay. And the healthy for osteoporosis, what things should we take? The vitamin D3 should be normal?
No, so ideally above 60, you should do especially a women above 60, you should do a DEXA scan. It's called a DEXA scan.
I'm 51, sir.
51, your calcium and D3. That's about it. And do strength training.
Okay, fine. Okay, sir. Thank you very much, sir. I'll contact you in person.
My pleasure.
Sir, we have a couple of questions in the chat box. So basically, there are some, people who have asked that there are some pain in arms, chest, and nerves, and there is a tingling sensation when they cough or sneeze.
Yes, so one thing which is it is that the difference between a back pain and an arm or a leg pain. Leg pain or tingling in the arms or legs, or numbness in the arms or legs, or burning in the arms or legs. This is typically because of nerve involvement. So any symptoms which are radiating to your limbs, and if they are not getting better within a week or 2 weeks time, this should be checked out as early as possible. Otherwise, it can cause a long lasting damage. Just neck pain, just back pain, initially, yes, with exercise, you can try with medications and other things. If it's been more than 2 3 weeks, not getting better, affecting you, yes, go and show it to a local doctor. And based on the clinical findings, they can either send you to a specialist if required. But if it's going down to your arms, legs, so even someone as Mr. Nabid has mentioned, my arms and chest nerves tingle and gets vibrated after cough and sneeze. That's because when you cough and sneeze, the pressure on the nerve increases because it is getting compressed. And that's the reason why you feel. So MRI is a must to find out what the diagnosis is, and then we can treat it accordingly.
Hello, sir. One more question, sir.
Yeah.
Last. Sir, which surgery is good? Minimal invasive endoscopy or open surgery?
In, open surgery was something I used to do in 2008 and 9, but now I don't think I have. Yes, there is a role of open surgery where we do. If I'm dealing with a very big cancer of the spine, or big, we operate younger patients, 10, 11 years old, who have a completely curved back like that, and we have to make them straight. But for adult degenerative like stenosis and slip discs for leg pains and all, I don't think I have done an open surgery in the last 12, 13 years now. The reason why, as I said, is the recovery is so much faster and the complication rates are almost negligible. So, it's like, now in today's world, you are not going to use a post box to deliver a letter. You will send an email. It goes.
Yeah.
So it's exactly technology. So the advantages of minimally invasive surgery, they they're way higher than a traditional open surgery. So for me, minimally invasive way is the only way out, not open.
Okay, sir.
Uh,
Okay, sir. Thank you.
Mr. Kiran Singh, you can unmute and ask your question. Please be brief as we are running short on time. Yeah, we can move on to next person, Mrs.
Yeah. So I'm actually 38 years old. I've had back pain, lower back for like the last only 2 or 3 weeks. I think a very sedentary lifestyle, especially in the last 2 3 weeks, like sitting on the chair 10, 12 hours a day. So I've iced and kind of rested the back. I know that's the opposite of what you said today. And in the last 10 days, it's improved a lot. Then again, suddenly from yesterday, it's hurting again. I haven't got any X-ray or MRI or anything. But given that it's improved significantly after icing over the last 10 days and then slightly gotten worse, it's like 5 steps forward, 2 steps back. Do you think it's something serious for me to get an MRI or just to kind of ice it?
I don't think so at all.
Yeah.
The fact that it did get better, it's not a red flag. Number one. Number two, as I said, if you saw the study where bed rest actually your recovery becomes longer.
Yeah.
Because you rested, your body was happy, and you started doing a little bit of activity, you may have got 2 steps back. Your pain might have come back. So important thing is, yes, you need to keep on moving. But I think one thing which you can start doing right now, since you're just 36, start exercising. Start stretching your hamstrings. Obviously, I'm not talking about going to the gym right now, but basic stretching. Go to a physiotherapist, learn basic exercises, stretch out your hamstring, quadriceps, glutes, start strengthening your core. Check your vitamin D3 and basic bloods if you've not done them for the last 1 year.
Yeah.
Get checked. A lot of times back pain is just because of low D3. So any small jog will aggravate your.
Yeah, sorry. I should have clarified the first thing. The first day that it happened, I couldn't even bend over to pick up something from the
So that
floor.
is because of muscle spasm.
Yeah.
That is because of muscle spasm. So when the muscles, so something may have gone off. Sometimes even a small tear in the disc can make your muscles go into spasm, because of which you cannot bend forward. Okay, or even getting up from a bed would have been difficult. But suppose the first time you get up, you get pain. Sit down. Get up the second time again within 5-6 seconds. Sit down. Then again get up. The fifth time you would have realized your pain would have been 50% better. So that is because of muscle tightness. And I said, the more you move around, the more you shift your position, you start feeling much better.
Got it.
I don't think there are any red flags. Just start gentle exercises. If you have access to a pool, start swimming from tomorrow, and you will be fine. Yeah. In case this episode is going on, frequency is increasing or the intensity of pain increases, then yes, you can start off with an investigation.
So sorry, just last question. In case it continues for, if it stays bad like it is for the last day or so,
then get an
for beyond a week, or at what point do you think I
in
should come?
your situation, if it comes and goes, give it time, exercise, wait it out. But if it gets significantly worse, or if the pain starts radiating down to your legs, then get an MRI done. Otherwise, I think you can wait it out for even 2 weeks. 2 months, 8 weeks.
Because basically, whenever I sit for longer periods, that's when it seems like it comes
This is
back.
as I said again, change your position. Change. You should not be telling me that I sit for a long time. That's what my point is.
Got it. Okay, thank you, doctor. Appreciate the.
Welcome.
Yeah, Mr. Rajkumar, you can go ahead and ask the question.
Sorry, since he's not asking the last question, if I may. So standing up is okay, while instead like rotating between sitting and standing is good while I have this back spasm or muscle.
Absolutely. So basically, if you're sitting for half an hour, 40 minutes, get up for 2-3 minutes. If you're standing for 15-20 minutes, obviously when you're standing, you are putting more pressure on your spine, right? So I would not say stand for 45 minutes and then sit down. If you have an opportunity to, if you're presenting somewhere or you have to stand, you have to stand. I mean, you cannot do anything about it. But otherwise, if you have an option, 15-20 minutes of standing or walking, sit down for that 1-2 minutes. But definitely, if you're on the laptop, you're in the office, you're sitting for 45 minutes, get up for 2 minutes.
Okay, got it. Thank you.
Yeah. Mallikarjun, ready? You can unmute your mic and ask the question. Yeah, okay. I will move on to the next one. Meghali.
Yes, sir. Good evening.
Hi, good evening.
Actually, I have done with MRI. It is shown that C3, C4, C5 level bulges are there. Along with that, C5 and C6 protrusion is seen. Actually, I have taken treatment from the neurosurgeon. He has suggested me 6 weeks bed rest. Actually, in my arm, tinglings are also there. It becomes heavy. Even inflammation is there. First, they suggested surgery. Then afterwards, they said 1 month at least we will go with this bed rest and all. Then we will decide what should be done, sir.
See, typically, the tingling in the arm, that means
your voice is breaking, sir. Your voice is breaking.
C5, C6 protrusion is what is causing your symptoms. The C3, C4, C5 is most likely just a age-related finding. Okay. The nerve is compression on it. That's why you are getting symptoms in your arm. Now, typically, that happens because of inflammation in the nerve.
Sir, sorry, but your voice is breaking a lot.
Sorry, can you hear me now?
Yeah, now I can hear you.
So your pain in the arm is going because the nerve is getting compressed because of the protrusion. Yeah. So if that is the case, and it's most likely your C5, C6 which is causing it. Now, when the nerve gets compressed, you start feeling symptoms because of inflammation in the nerves. So a painkiller does not help, but an anti-inflammatory muscle relaxant helps in this case. So typically what we do is we start medications for 2 weeks. I tell my patients, the minute you feel that the symptoms are better by 50%, you start physiotherapy, start exercises. Okay. Yeah, if suppose your job entails lifting weights, then I will not let you do that. But if your job entails where you are going to the office, you can manage other things, I will not let you stop doing that because I believe in no bed rest. It doesn't.
Actually, working as a principal, so I have to sit for a long time.
Even if I sit for a long time, but your job does not entail anything heavy, you can keep on moving. So it should not be a problem. Okay. But if the medications is helping, you start physiotherapy. If it's been 4-6 weeks, you stop all the medications after 3 weeks, your pain is not worsened, you wait it out, your protrusion, the body only will heal it. And generally within 6 weeks to 3 months, majority of patients get better. If you don't get better still and your arm symptoms still persist, then you may have to go in for an injection to buy time for the 3 months to happen. And if last but not the least, if nothing is improving, you are getting worse by the day, then obviously this endoscopic from the back and freeing that nerve will help you 100%. But I feel majority of the times, just with exercises and
Hello.
taking it easy, you will get better.
Okay. Along with this, sir, lumbar vertebrae gap is also there.
Just exercise, nothing to do for that. Just
Okay,
exercise.
sir.
Maintain your lifestyle.
Thank you, sir. Thank you so much.
Welcome, welcome.
Yeah, sir, there was a question in YouTube channel, sir, that there was a CFS leak and it was cured through injection from
I think
back,
the
but
question is
now the pain in the neck
probably
has
someone had taken an injection in the back and then they might have had a CSF leak. And now the pain has occurred in the neck. See, a lot of these things will depend on when the injection was given, when that leak was. But typically, if it was before 6 weeks, anytime before 6 weeks, it could be 1 year, 2 years, 3 years. Usually, it cannot be because it cannot cause any pain in the neck. Your pain in the neck is basically because of your lifestyle. Only if the leak has happened very recently and then the neck pain has started, then they must consult a specialist, because sometimes if recently they have taken an injection and the leak happened, and if there is an infection inside the spinal cord in the water CSF fluid, then it can cause significant neck pain. So then they need to go urgently if it is something which is very recent, the injection given. But if it was something which was in the past, then what they just need is exercises.
okay. Mr. Rajkumar has raised his hand again. Rajkumar ji, if you are online, you can unmute and ask your question.
Yeah, can you hear me, Dr. Sir?
Yes.
Good evening, Dr. Sir. Rajkumar Jhaveri. I am 58 years old and normally I am pretty healthy. I go to gym regularly.
Lovely.
But last 2 months, I am having pain in my left leg. 6 months back, I had this thing. મને મોચ આવી ગઈ હતી કમરમાં. ત્યારથી મને લેફ્ટ લેગમાં થોડો પેઇન રહેતું હતું. અને અનફોર્ચ્યુનેટલી મારા ડોક્ટરે મને બેડ રેસ્ટ કીધું. એકદમ સુપર્બ નથી થઈ ગયું. તો કેન આઈ સ્ટાર્ટ ગોઈંગ ટુ ધ જીમ અગેન ઓર આઈ શુડ?
તમે MRI કરાવેલું?
હા, MRI કરાવેલું જ્યારે મોચ ઊભી હતી ત્યારે.
Did it show anything?
હા, એટલે એ વખતે મને ડોક્ટરે ફિઝિયોથેરાપી ને બધું કરવા કીધું. મોચનું પેઇન જતું રહ્યું અને લેફ્ટ લેગમાં થોડું પેઇન રહ્યું, થોડી ચાલ ચેન્જ થઈ ગયેલી.
તમારું ડાયગ્નોસિસ એ વખતે સ્લિપ ડિસ્ક ના કારણે નસ દબાતી હતી કે ઉંમરના હિસાબે જે જોઈન્ટ્સ વધે એના કારણે નસ દબાતી હતી? What did the doctor tell you?
ના, એવું મને ડોક્ટરે કીધું નહોતું. એમણે કીધું ફિઝિયોથેરાપી કરો, દવાઓ લો. અને એ કમરનો દુખાવો સારો થઈ ગયેલો, પણ લેફ્ટ લેગમાં થોડું ખેંચાતું હોય ને એવું ચાલુ થઈ ગયેલું.
અજીન પણ છે.
તો ઇઝ ધીસ વેરી સિરિયસ? તમારી પાસે આવીને બતાડી દઉં કે થોડું?
If the leg pain is persisting, then it is important to find out why that pain happened. Because left leg pain means the nerve is still irritated.
Okay.
Then, and if it is, some other, now if there is a joint which is pressing your nerve, exercise will be very different. You have to avoid some exercises, you have to do some exercises. But if the risk is still there, then again the exercise is completely opposite. So the very important thing is that what is the symptom, which is, if it is leg pain, I would advise let's establish what is compressing your nerve, so accordingly we can start the exercises. Khali leg pain na hoy, ekdam mild hoy and back pain pa na hoy, then definitely you can start some exercises, stretches, core strengthening and other things, and you can see if you feel ke nahi ya to jatur nathi ke vadhya kare, to pachi just come and show it to.
Okay. એમ તો પેઇન સિવિયર નહોતું, 10% 15% જેવું જ હતું, પણ 2-3 મહિના રહ્યું પેઇન.
આ તો આજની સ્થિતિ શું છે?
બેડ રેસ્ટ કરું છું ને સિન્સ 20 days, તો એટલું બધું પેઇન નથી.
No, then I would suggest you that you start your slowly activities. Forward bend ne koi weight nahi uparta hamna, but you start your daily activities, start little bit of your exercises, physiotherapy, and if the pain still persists for the next 10-15 days, to તમે એકવાર એને દેખાડી દેજો. Hello.
Sir, we'll take one last question from Mr. Tejas.
Yeah.
Mr. Tejas, you can ask your question.
Hello.
Yes.
કેમ છો મજામાં?
But all well.
બધું કે ડોક્ટર જયને આપણે વાત કરી હતી તો મેં ડોક્ટર જય પાસે ગયા હતી ટ્રીટમેન્ટ માટે. હવે જયે કીધું કે મને ડોક્ટર જુગરગડા પાસે ગઈ હતી, મને છે ને ઓસ્ટોપોસિસ ના રિપોર્ટ બતાવવા આવું છે. મેં કીધું ક્યારે આવું?
અપોઇન્ટમેન્ટ લઈ લેજો ને ક્લિનિક.
અપોઇન્ટમેન્ટ લઈ લો.
ઓકે
ઓકે, ઓળખાણ પડી ને?
હા. Okay.
Thank you, sir. I think it's been a really wonderful session, sir. A lot of insights to how to manage the back pain. We can, we can close the session, and I'll thank you once again for joining with us and helping all these patients to treat their back pain and how to manage their back pain. Thank you so much, sir.
All right, thank you so much, Adarma. Thank you, everyone. Thank you.
Sir, we have shared the details in the group to the participants who are still available. We have shared the details in the group, and sir has also shared his clinic address and number in the chat box, so you can connect if you have any further questions. Thank you.
Thank you. Bye bye.